Hi guys, Nash here. I want to talk to you today about eating after COVID-19. If you've seen my previous videos in which I talk about the symptoms and obviously training that followed my recovery from COVID-19, you've learned that the symptoms were quite serious and the training had to be very sensible. You have to start training with a medium intensity once you're ready. Some people may start the same week, 4 or 5 days after they recover. Some people may take a bit longer, maybe a couple of months or a month, but that's very individual. So I would not insist on some rules. I'm just giving you my advice, and I hope that you can use my advice as a guidance and benefit yourself in the best possible way. Always consult your physician regarding your training or regarding your diet plan after recovering from COVID-19. But in this video, I'm going to say to you a few words about my diet. So first of all, when I went to the hospital, I lost appetite completely. I couldn't eat. And it's not just appetite, it's simply the body didn't want the food, because your body is fighting the virus, and digestion is a very expensive physiological process. It takes a lot of energy to digest food. So whenever you're sick, for example, animals, they don't want to eat at all. So the whole physiology of a specimen of any species is actually focusing on immunity and defending the system from the virus or bacteria. So this is the main reason why we lose appetite. So in the hospital, I was eating like hardly. I could have hardly eaten a couple of eggs. I mean, usually I have 5-6 eggs in the morning, and then all of a sudden you're on 2 boiled eggs and you're eating them like for 20 minutes. So I think I lost about 6-7 kgs in those 10 days in the hospital, which is obviously not a catastrophe, but it's the fact. So if that happens to you, don't panic, don't make a catastrophe out of it. It's nothing dramatic. You're not going to get that back. But the point is that after I left the hospital, it took a few days, maybe 4 or 5 days. So my appetite started improving, and I started eating a little bit more. So don't force yourself. Just eat, be comfortable, enjoy your food. Try to find the food that you can digest easily. Do not overeat. Do not stuff yourself, because you're not going to put back your 5, 6, 7 kgs of pure muscles in a few days. It's going to take up maybe a couple of months, maybe 6 weeks. And obviously it has to be directly related to your training. You need to go back into training, because the body is not going to put pure muscle back without really having a need for that. The only physiological requirement for putting the lean muscle tissue back will be your training intensity. So if you start training again, and when you start training again, your appetite will increase. This is exactly what happened with me. Once I started training, I realized that I started eating more, a bit more, and in the second week of my back to my training routine, I was back to 4 meals a day. So in the beginning it was 3, and 3 meals per day were all that I could have done. I was quite satisfied, so I didn't force myself. So 3 meals a day, first couple of weeks. This is my story. Now the third week, I'm already on 4 meals a day. Again, it's happening spontaneously. I'm not pushing myself. I'm not forcing anything. This is just what I feel. Obviously my training weights went up a bit. Intensity is going up. I'm breathing better. I'm feeling better. So that all reflects into increased demand for food. The message that I want to pass to you through this video is that you can't force it. You have to be patient, and first of all, you have to be happy that you're healthy again, that you're pumping weights again, that your circulation is better, that your mobility is back, and you need to enjoy every moment of your life every day. So training 3-4 times a week and eating healthily will obviously bring your appetite back to what it was in the past. And just take your time, don't rush it. It will take a few weeks and you will be back. It's just I'm trying to give this thoughts and my experience, so you can use them as guidance. Obviously, do not repeat. Don't do what I've done. Don't eat as I do, because I'm just telling you my story. This is my experience, and you have to find out what works for you. A few principles are obviously important to remember. Do not rush. Don't force yourself. Don't try to be the best as you can, as you've been in the past in few days. Be careful. Monitor your heartbeats. Monitor your breathing, your tiredness. Do not exhaust yourself, and let the body come back to normal, and the appetite will come back as you recover. So don't worry about it; it will happen. And take care of yourself. If you did not get your vaccine, please do, because it is important to protect yourself, and you don't want to go through my experience. So get vaccinated.